Education. We are honored to have with us today Sister Rabia Akram. She is current President of American Muslim Health Professionals. She received her bachelor's degree in psychology from University of Illinois at Urbana-Champaign and went to earn her master's in public health and business administration. She worked in community health at Sinai Community Institute in North Lawndale to increase the immunization coverage rates among undeserved children. She is current board member of Taqwa Eco Foods, a Zabia organic meat cooperative, and recently completed her AMCLA fellowship. Her interest lies in public health and special interest in global health and health policy. Sister Rabia Akram, welcome to ISNS. Inshallah, the topic today is new health reform. As you know, there's a lot of talk has happened around this, and it's a law now. So it's a 1,000 pages bill. She will try to cover it in 1 hour, inshallah, and then half hour we'll have question and answer.
Just have her put it in a simple English for us.
Yeah, that is the idea.
Hey, assalamu alaikum, everybody. So actually, the presentation in itself isn't that long, so hopefully most of the time will be spent in question and answer. So let's just get right started. So just to give a little information about the American Muslim Health Professionals, the organization has been around since 2004, and this presentation was developed in partnership with all of these organizations. Particularly, the Herd Ending Alliance is an organization that focuses on messaging of really complex things such as healthcare, and their focus is specifically on healthcare. So I'm going to go through who we are, why reform was needed, and how it will help everyone, and some common questions that people often have when they talk about the health reform law. So just some information about the organization. Like I said, we were founded in 2004 by health professionals. It's for all health professionals, physicians, public health practitioners, dentists, pharmacists. It's a pretty big umbrella organization for anyone in the health-related field. We have over 1,500 members throughout the nation right now, and 35 affiliated free clinics and community clinics, including things like Ummah Clinic in LA and Iman here, etc. So, our mission is to empower Muslim health professionals to improve the quality and delivery of healthcare services to all people. So we do one of our big things this year will be health education. So we've been doing a lot of health education workshops and things like that. Networking, and then advocating on health policy and advocacy on behalf of health professionals. So, my background, as the brother mentioned, is in public health. I've worked at both the community level and at the global level, and my particular expertise is in health policy. So why is reform, or why was it needed? Too many people, I think at the height of 2008, it was about 52 million people were uninsured, an additional 25 were underinsured. In 2007, 1 out of 3 Americans lacked coverage at some point in time. The vast majority of those who do not have health insurance are employed full-time. And for those that do have it or can get it, they often pay too much for pretty inadequate health coverage. And as I'm sure many of you know, that the United States spends more on healthcare than any other developed country, over about 15%, actually over 15% of our GDP at this point. And everybody, pretty much everybody within healthcare, and anybody who's ever had interaction with the healthcare system, realizes that there was a need for change. So, as I mentioned, everybody pretty much recognizes that, from the biggest, such as the AMA, who has historically been against healthcare reform, was for it, because they realized that what we were doing was unsustainable. So how this new law will help you? It will make existing healthcare coverage more affordable, particularly if you do not receive coverage through your employer. So the vast majority of the bill is really targeted to people that don't get health insurance through their employer. which the vast majority of people that are not insured or underinsured, that's the problem. And it does improve medical benefits in that at some point by 2014, there will be a standard where every health plan has to have. So there can't be, you know, some plans provide a lot and others provide very scant. There will be a standard that everyone will have to provide these basic coverage things. And then there's a lot of regulation on insurance companies. So the idea being that they will deliver better service to their patients, their clients, as well as it will extend coverage. One of the big things is it will extend coverage to an additional 30 million people by 2014. Extend coverage to everyone, which creates healthier communities overall. It will help doctors and other health practitioners to do more and receive more for what they do. And ultimately will control, or the hopes of the legislation is that it will control costs. So I will go through a lot of these points in more detail now. So, and I'm only going to give some, because there's, as the brother mentioned, there's a lot in the bill, so if you have specific questions, you know, please ask. But I'm only going to touch on some really basic things that I think are most relevant to the majority of people. So one of the things that will happen is that it will limit out-of-pocket expenses for most people. So the way that really works is that out-of-pocket expenses are going to be capped for most people at 9.5% of your income for anyone who earns around $85,000 or less, which is the vast majority of Americans. Over, I think the average income in the U.S. is around $50,000. The vast majority of people do not earn, you know, $200,000 or something like that. The vast majority of people earn quite low. So this is a huge thing in that you will never spend more than 9.5% of your income on out-of-pocket expenses. So out-of-pocket expenses include things like co-pays or deductibles, things like that. The other thing that it will do is it will limit the individual's premium contributions. So what the bill does not do, it does not limit what the premiums can be or what the premium increases will be. But it will limit what an individual will contribute to that premium. And the way that does that, again, it is up to 400% of the poverty level, which is around $88,000 a year. So if you earn $88,000 a year or less, you will get subsidies to help pay for your premiums. Those subsidies will be based on a sliding scale, so obviously the less you make, the more amount in subsidies you will get to provide to help pay for your premiums. And the other huge thing that it does, particularly for seniors, is that it helps close the donut hole in Medicare. So when the prescription Medicare bill went into effect, like 5-6 years ago under the Bush administration, it has this huge hole in the middle of coverage where a senior has to pay full price for everything out of their own pocket. So. And what this law does is it will start closing that donut hole this year, and it will be completely phased out by 2020. So how does it improve your insurance benefits? Like I mentioned, that there will be some standards that all insurance companies will have to provide. This will especially be the case for any insurance company that hopes to provide